Good morning, everyone. Thank you for coming. Today is February 25th, and it is the Inservices. Hannah Rooks will be going up first, and she's going to talk about sciatica. Please hold your questions till the end. You can, if you have the ability to type them in chat, you can type them in chat, and we will get them as we go through. And now I'm going to turn it over to Hannah, who will share her screen, and she will go ahead and get started.
Pardon me while I pull this up. My PowerPoint has not been working very well today. So again, there we go. Okay. Sorry about that. Can everybody see everything? Hello?
Yes, looks great.
Okay. All right. Okay. All right. So my presentation is on sciatica, and I apologize, it just went a little crazy on me. There we go. So the objectives of this presentation are to describe what sciatica is and its impact on patients, to teach the pharmacological and non-pharmacological treatments, and to discuss steps to prevent sciatica. So first, you can't talk about sciatica without discussing the sciatic nerve. It is the longest nerve in the body, and it originates in the lower back and at the base of the spine and above the tailbone. It goes from the hip down the leg, and it has several smaller nerves that go into the thighs, knees, calves, ankles, feet, and toes. And sciatica is just a general broad term for any pain that follows the sciatic nerve. It's not a specific diagnosis. The diagnosis would actually be what caused the sciatica. So it's pain that's due to a compressed and or irritated sciatic nerve root. And the pain can be felt anywhere along the sciatic nerve, but it typically radiates from the lower back of the, from the lower back or the hip and down the back of the thigh and into the leg below the knee. The pain may be accompanied by a pins and needles numbness, burning or tingling sensation, muscle weakness, and or poor reflexes along the path of the nerve. The pain is most often described as electric, burning, or sharp, but it can vary. The pain can be excruciating and can worsen when you bend down, twist your spine, cough, or sneeze. And the pain may last for weeks before it goes away. Sciatica normally affects only one side of the body, but it can affect both sides. However, if on both sides, it is less likely that the pain is caused by a pinched sciatic nerve. Sciatica's lifetime incidence is 10 to 40%, and it most commonly occurs to people in their 40s. The annual incidence rate is 1 to 5%, and it is not more likely to affect one gender versus the other. However, it is more likely to occur in certain occupations. That would be machine operators, truck drivers, or any jobs that require physically awkward positions. Sorry. Okay, so some risk factors for sciatica. Age-related changes to the spine can cause it. Obesity, it places additional stress on, excess weight will place stress on the spine and can contribute to changes in the spine that can trigger sciatica. Occupational, occupations that involve pushing your back, heavy lifting, or driving a motor vehicle for long periods of time may increase the risk of developing sciatica. People who are sedentary, so prolonged sitting, people who sit for long periods. I'm sorry.
Back to you. So Trey, about those people that are waiting, and we just heard from Mike Tobin talking about the men ages 18 to 6.
I'm sorry, I can't hear you. Are you talking to me? Hello?
I think they were having a separate side conversation.
Oh, okay.
You're good.
I just wanted to be sure. I'm sorry.
You're good.
So let me go back to what I was doing. Okay, so people who sit for long periods of time or engage in little physical activity are more likely to develop sciatica. And diabetes is also a risk factor because it increases your risk of nerve damage. As we all know, there is peripheral neuropathy that can occur in that particular disease state. So some common causes of sciatica. For people who are under the age of 40, the cause is typically a herniated disc. And older adults will usually experience sciatica due to bone spurs or arthritis. A herniated disc is also sometimes called a slip disc or a ruptured disc, and it is the most common cause of sciatica. The disc between the vertebrae in the lower back may bulge or herniate, which causes irritation or it can compress the nerve itself at the sciatic nerve roots. It compresses the spinal nerve. Another common cause is degenerative disc disease. So the vertebral disc can wear down with age, and if they become too thin, the space between each vertebrae becomes compressed, which puts pressure on the sciatic nerve root. If the outer covering of the disc were down, the fluid from the disc may leak out and irritate the sciatic nerve. Bone spur on the spine is another common cause. The bony projections develop along bone edges where the bones meet in joints or in the spine. And the main cause of bone spurs is joint damage from osteoarthritis. It narrows the space that the spinal cord runs through, and it can pinch the spinal nerve or its nerve roots and can cause weakness or numbness in the arms or legs. Spinal stenosis is another common cause. It's a narrowing of the space that the spinal cord and sciatic nerve roots travel through, which can cause compression, and it may be caused by arthritis or aging. It puts pressure on the nerves that travel through the spine. Spondylolisthesis, vertebrae are naturally designed to be stacked on top of each other for stability. But if one vertebrae in the lower back slips forward over the vertebrae below it, it can actually press down on the sciatic nerve. Vertebral fracture, that's spondylolysis. That occurs when part of the vertebrae that forms a joint cracks or fractures, and it can compress a nerve. Piriformis syndrome, that's where the piriformis muscle that typically runs on top of the sciatic nerve in the buttocks. It can compress the sciatic nerve if the muscle becomes too tight, and the symptoms will worsen after sitting for a long time, walking upstairs, walking or running. And piriformis muscle it's a flat band-like muscle that runs from the sacrum, which is the triangular bone below the spine, to the top of the thigh bone in the hip joint. So there are some additional complications from sciatica. Patients may suffer from loss of feeling in the affected leg or weakness in the affected leg, and they may also lose their bowel or bladder function. There are some conditions that can mimic symptoms of sciatica. So sacroiliac joint dysfunction, where joint problems in the pelvis that cause pain in the buttocks may radiate down into the upper leg. There may be a tight iliotibial band, which is the tendon that runs down the length of the outer thigh. Tight hamstring muscle can also mimic symptoms of sciatica. Stress on the spine from pregnancy, and there's also cauda equina syndrome, which is caused by a herniated disc pressing down on the cauda equina nerve roots at the end of the spine, and this can cause a radiating pain, weakness, potential bowel or bladder incontinence, and progressive motor or sensory loss. This is a medical emergency that should be addressed immediately to prevent any permanent problems. And if radiating pain stays in the buttock area and doesn't travel down the spine, it only travels halfway or only travels halfway down the thigh, it is less likely to be sciatica. So how is it diagnosed? Well, it's done primarily through a physical exam and taking a medical history. During the exam, the doctor may be able to pinpoint the irritated nerve through physical examination. They may ask patients to perform specific movements such as squatting or rising, walking on your heels and toes, and performing a straight leg raising test or other tests. Imaging can be done through X-ray, MRI, CT scan, or electromyography. but it's not necessary in most cases, unless they're trying to rule out other diagnoses or there are signs and symptoms of a more serious condition. So treatment. If sciatica is due to a back strain or injury, it does typically start to feel better within a few days, as long as you don't strain your back again, and you can take medication for pain and inflammation. The pain normally resolves in a week or two. If you go see a doctor, the doctor may recommend resting for a day or two, but the doctor may recommend longer, but it's actually best to try to remain somewhat active. Exercise or physical therapy can help strengthen the back and back muscles to help avoid further injury. If this is the case, the doctor will tell you when to start exercising. Medication can also help to treat pain or relax muscles, and surgery in some cases, if the pain doesn't go away for an extended period of time, may also be something that is done in order to, but it does depend on the cause and how long the pain is present. So medications. The first line medications of choice are NSAIDs and acetaminophen. So the NSAIDs are your ibuprofen, otherwise known as Advil and Motrin, aspirin, naproxen, otherwise known as Aleve, and celecoxib, which is the prescription one, also known as Celebrex. Acetaminophen is Tylenol. In some cases, so there are a couple of things to kind of keep in mind with these particular choices. And I wasn't really sure if I should go too into depth on these, but I did want to make sure to make some notes specifically for the ones that are available over the counter, because those are the ones that are most accessible to patients. So as far as for the NSAIDs, they are used for both pain relief and decreasing the inflammation. However, they want a couple things to make note of. They're not recommended for people who are on direct or oral anticoagulants. So that would be Eliquis, Xarelto, Pradaxa, Lixania, and Beviexa, because unfortunately the combination does increase bleed risk. Also not recommended for people with heart disease or a history of heart attack or stroke, because it does come with an increased risk of heart attack or stroke. And you do also want to avoid use of the non-aspirin and NSAIDs, that would be ibuprofen, naproxen, and celecoxib in patients with a history of peptic ulcer or stomach bleeds, because they can increase the risk of that reoccurring. Do you want to avoid using this with alcohol, because that can increase the stomach bleed risk? Acetaminophen or Tylenol, the other first line treatment, is primarily for pain. It is the preferred drug for people on the direct oral anticoagulants and people with a history of heart disease or a history of stroke or heart attack. You do want to make sure to use caution if the liver is impaired, because it can affect the liver. So one thing that we do want to make sure to point out to some of the older patients is that the max daily amount for most patients is 3,200 grams, but for patients over 75, it's really more 2,000 milligrams to 3,000 milligrams. It's also available in a lot of over-the-counter drugs, so you want to watch out for those hidden forms of Tylenol, because it is very likely that it could be in any over-the-counter cold or flu medication. And taking too much can harm your liver. So for most adults, they can take 325 to 650 milligrams by mouth every 4 to 6 hours, or 1,000 milligrams every 6 hours is needed. But if they're over 75, it's really safer to stick on the lower end. That would be 325 milligrams every 4 hours, or 500 to 1,000 every 6 hours. This is another medication you want to avoid mixing with alcohol. So there are two classes of medications that can be used, but they're not really recommended, especially if the patients are over the age of 75. One is the muscle relaxants. That's cyclobenzaprine, otherwise known as Flexeril, tizanidine, otherwise known as Xanaflex, and metaxalone, otherwise known as Scalaxin. These relax the muscle. However, because of their side effects, which are dizziness, drowsiness, confusion, fatigue, blurred vision, dry mouth, and nausea, they do increase the risk of falls in patients who are elderly. There's also another class of drugs that you don't want to mix with alcohol because it can intensify the effects. Opioid pain relievers can be used in some cases of chronic pain, but again, not recommended in our elderly patients. So that would be tramadol, otherwise known as Ultram, tramadol with acetaminophen, Ultracet, oxycodone, brand names are Oxycontin and Roxycodone, oxycodone with acetaminophen, which is Percocet and Endocet, hydrocodone, that's Vicodin, and hydrocodone with acetaminophen, which is Vicodin, Norco, or Lortab. Again, these are only recommended in people with really severe back pain and chronic back pain, but it's also no more beneficial than NSAIDs or acetaminophen. And again, because of the side effects, which are dizziness, drowsiness, fatigue, depressed breathing, and risk of abuse, these can increase falls risk. So that's why we're not recommending them in these patients. Interactions also don't mix it with alcohol. In some cases, antidepressants may be used as well to help out with the nerve pain. And that would be amitriptyline, otherwise known as Elavil, nortriptyline, otherwise known as Pamelor, venlafaxine, brand name is Afixor, and duloxetine, which is Cymbalta. These do come with some side effects as well. They can cause dry mouth, constipation, weight gain or loss, low blood pressure, rash, and increased heart rate. The anti-seizure medications, gabapentin and pregabalin, that's Neurontin, Horizon, and Release for gabapentin, and the brand name for pregabalin is Lyrica. Those also work on reducing nerve pain. They do have dizziness, drowsiness, fatigue, nausea, tremor, rash, and weight gain as their side effects as well. Patients can also be put on steroids. They could take oral prednisone, but with this particular case, it also, especially if it's severe chronic pain, they could take the injectable as well, which is triamcinolone or Kenalog, methylprednisolone, which is Depomedrol, or betamethasone, which is Celestone. And these are used to suppress the inflammation around the pinched nerve. The only one of the things with these, because one of the things with these is that they are limited use. So although the injections themselves can last a long time, unfortunately, it does weaken the immune system, and the side effects do limit the use as well. Side effects for these are high blood pressure, insomnia, increased appetite, blurred vision, and increased blood sugar. Now, medication therapy is very important for sciatica. So you can use hot and cold therapy. So you can place an ice pack, gel pack, or package of frozen vegetables wrapped in a cloth to protect your skin on the painful area for up to 20 minutes at a time. And you can do this every 3 to 4 hours. You can put hot water bottles or electric heating pads on your back, but you do want to avoid burning your skin. So you want to cover the hot water bottle with a towel and set the heating pad on low, and definitely don't want to fall asleep with the heating pad on. You can apply moist heat to the injured area for up to 10 to 15 minutes at a time before doing warm-ups and stretching exercises. Moist heat can help relax the muscles and make it easier to move. And to apply moist heat, you can use heat patches, moist heating pads, wet washcloth, or a towel that's been heated in the dryer, or just have a hot shower. That you can get a professional back massage, but definitely make sure it's a professional who knows what they're doing. Can change the position throughout the day in order to relieve stress on the back. So you can try alternating between sitting and standing. If sitting for a long time, can try to place a foot on something like a box or a low stool. And if you have to sit for a long period of time, you can place the cushion on the painful side to help relieve the strain and the stress. If you smoke, you do want to try to quit. Smoking reduces blood flow to muscles and discs in and around the spine, and people who smoke generally recover slower from injuries. So physical therapy it may be useful as well, but you do want to make sure that you work with a physical therapist because not everybody's gonna be able to do the same exercises and the same techniques, and also want to avoid re-injuring that back. So you can maybe give in exercises to help strengthen the back, and it's important to walk and move while also limiting too much bending or twisting. Following treatment, you can resume normal activities, and it's important to take steps to prevent sciatica from reoccurring. Because unfortunately, you can rupture that disc again. In some cases, surgery may be necessary if pain persists for 3 or more months. So there are 2 different surgeries. One is the laminotomy and the laminectomy with the discectomy. And basically the herniated disc or bone spurs are surgically removed. It is usually successful at relieving pain, especially if most of the pain is in the leg. So while sciatica, it's important to treat it, it's also important to prevent it. So some of the things that can be done is exercising regularly by strengthening those core muscles. Those are the muscles around the abdomen and the lower back that are important for proper posture and alignment. You can actually reduce your chances of developing sciatica. Staying physically active every day and making sure that you use stretching and warm-up exercises before doing any exercise can also help avoid hurting yourself. Maintaining proper posture is also very important. So standing with your head up, shoulders straight, chest forward, and weight balanced evenly on both feet and the pelvis tucked in. If you're sitting, you want to sit in a straight back chair with a good lower back support, armrests, and a swivel base. You want to make sure to hold your spine against the back of the chair when sitting. And you can place a pillow or a rolled towel in the small of your back to help maintain the natural curve because the back is not naturally straight. You want to make sure to keep knees and hips level. If you do stand in one spot for a long time, you can rest one foot on a footrest, short stool, or a small box periodically to help keep the back straight. And if you use good body mechanics to protect your back, especially if you're moving things, that's also important. So you want to make sure that you use those proper lifting techniques to lift and move heavy objects. Don't face the object and push with arms if you're moving it. You want to turn around and use your back to push backwards so the strain is taken up by the legs. If you're lifting a heavy object, you want to make sure to bend at your knees and hips and keep your back straight to avoid putting that stress on the back. If you do a lot of heavy lifting, you can wear a belt designed to help support your back. You do want to avoid lifting heavy objects higher than your waist. And as always, don't be afraid to ask for somebody to help you if you're moving something heavy. If you're carrying packages, you want to make sure to carry them close to your body with your arms bent. And with sleeping or resting, it does help to lie on your sides with your knees bent. It may also help to place a pillow between your knees. And if you sleep on your back, you can put a pillow under your knees. As with many other diseases, if you are overweight, losing weight will help reduce the strain on your back and your legs. And there are my references. Does anybody have what questions do we have?
I was wondering if, and this may be too specific, but like when you have a sciatica, like let's say an initial flare up, are there any more recommendations as far as when you use an NSAID and can you, like I've heard people say you can do like what's called that initial dose. You know, I know it's like more like prescription strength, but either 600 or 800 milligrams and then alternating to the lower dose. And then putting acetaminophen on the opposite side of that, so you can alternate between the two. Between the Tylenol and the, let's say the Advil or something like that.
Yes.
But then also, and just another quick question, I'm sorry if that's too much, but it alternating with heat and cold. I had back issue. It was a long time ago. My
Mhm.
husband currently has back issues. I don't know if his is sciatica, but probably maybe even worse. Honestly, I think he's got some ruptured discs, but just with hot and cold, like I had always put heat on everything, but found out that cold works a lot better. So I didn't know if you had any like suggestions between heat and cold and which one's better initially, or if there were, and if that's too much, I'm sorry.
Oh,
Thank
no.
This is
so
it's a great presentation. Thank you.
Oh, so in regards to using both Tylenol and an NSAID like ibuprofen, there wasn't any specific guidance that I could see on the exact dosing. I think the big thing would be whether or not you're seeing a provider, because of course the over-the-counter dose for ibuprofen would be 200 to 400.
Sure.
Versus prescription, that's when you get into the 400 to 800 milligram dose.
Gotcha.
I know a lot of times, so for a number of different disorders, though it didn't, what I was able to read on the guidelines did not specify doing both Tylenol and an NSAID. But I know a lot of times for some pain conditions, they'll mix it where they'll take them just, like 2 to 4 hours apart, because we're working by 2 different mechanisms of action in order to work on that pain. And because they work by 2 different mechanisms of action, it's less likely to cause any particular type of harm. So if it's a severe pain, I don't know what the guidelines specifically say on that, but I do know that it's used for other conditions to use the 2. As far as hot and cold, the guidelines said it really depends on the individual. Some people respond better to heat, some respond better to cold, and some actually do better if they alternate the 2 types of therapy. So that would really be up to the individual.
Okay, great. Thank you.
Excellent. Are there any other questions for Hannah on her presentation on sciatica? All right, hearing none and seeing none in chat, Hannah, you can stop sharing your screen. Thank you.
Thank you.